There you go. Awesome. And we're going to do what Joe suggested last week. I loved his suggestion. Every time I answer a question, every time we give the answer, we give lots of love to the mama who asked that question, okay? So great. So let's answer the first one. The first question, I'm going to go back a little bit because this person asked this question a few days ago on my wall. And a lot of you guys know that you can post questions to my wall, and that way, you know, when I do my Q&As, I will try to get to them, okay? This question came from Addie, and I know she's waiting to hear this, and I think a lot of you guys want to know this answer too. She said, I just watched the video that I posted yesterday on the Q&A with Jamie about nursing bras, and she had questions from it. She was asking, where do I recommend finding bras that do come in those bigger sizes? And she always has a nightmare with sizing before getting pregnant, so she's worried about finding properly fitted nursing bras. And the second part of her question is, how far along do you recommend being before buying nursing bras? Obviously, we want to have them before we go into labor, but when should we get sized for them correctly? Okay, great question. And nursing bras, fitting bras, maternity bras, all those, doing all that is something that I'm going to spend some more time with you guys doing in the months to come. We're probably going to do a special, we've been talking about it for a while, on bra fitting because it's something that I did for many years. I had a retail store. I sold nursing bras. A lot of you guys who might be watching have stood in that fitting room with me and had me fit your nursing bra. So let's just talk about for a minute, when do you actually fit the bra? And then I want to talk a little bit about how to know you got the right size. And although a lot of the advice that you'll hear is, you know, wait till the very end. You have to wait till the very end because you don't know what size you're going to be. I actually think it's worse to wait till the end to fit your nursing bra because as you progress into the pregnancy, what happens is your belly gets bigger and bigger. Surprise, surprise, right? And as your belly's growing, your rib cage is expanding. And you know what I'm talking about. Your bras start to feel tight around the band. And what happens is you can't really get the right sizing. If you wait till the very end, you really have to fit your nursing bras to where they will not close in the back and you need to put an extender in. If you want that bra to fit you long term while you're nursing your baby, and you do. Nursing bras, good ones, they're expensive. You're not buying them just for a few weeks of pregnancy and then wanting to toss them. You want to use them. So the best time is any time after 20 weeks of pregnancy, and that's halfway through. The closer to 20 weeks, the closer to 24 weeks, at that point, your body and your rib cage is about where it's going to be postpartum. And so when moms used to come in to do fittings with me, I really liked for them to come in around that 24 week mark because it would give me the best estimate of what their band size was going to be. Now, as far as the cup size, most of the breast growth that you're going to have during your pregnancy will occur in the first trimester. So if you hadn't noticed, it's usually one of the first signs that you're pregnant is that your breasts have increased in size, that your breast grew. And that's what you're going to see is mostly in the first half of the pregnancy is where most of the breast growth occurs. Towards the end of pregnancy, you might have a little bit more growth, but generally what you'll see is that you're getting a growth in the band. So the bras might feel tight, but it's not usually your breasts that are growing at that point. It's usually the band size because of the rib expansion. So fitting your bras midway through pregnancy, fitting them so that the cup is fitting well with a smaller band is really where you're going to be later. And this is the mistake that so many people make when they fit their bras or they even get fitted for bras, is that they go too big on that band size and too small in the cup size. Now, this happens for multiple reasons. One is that, you know, when they measure around your body, they're measuring that rib expansion if you're going in too late in the pregnancy. The other part of it is that to really fit the bra, some of you guys, and you know, are going to be like a triple D, an F cup, an E cup, a G cup. Those are normal sizes for a nursing mom, and that's the kind of bras that you need. If your cup size is big, you need to make sure that the place that you're going to fit your bras carries that size, okay? Because it's not good enough to say, all right, well, I'm really an F cup, but they don't carry F, so I'm going to go with a D, and I'm just going to go 3 sizes bigger in the band. all that's going to happen is that the band is going to be riding up in the back. Your breasts are going to be sinking. It's just, it won't fit well. So you really need to find a place that fits bras and specializes in nursing bras to get a good sizing on it. Unfortunately, I know so many of you guys are ordering them online. And you're asking me, where do you go? I mean, I have people calling me all the time, you know, where's your store? Where do I get my nursing bras now? So, you know, that's the hard part, is that you really do need to find somebody who knows how to fit properly. But if you were going to just take a little bit of advice, go smaller in the band, go closer to what you were pre-pregnancy and bigger in the cup, and get one of those extenders and put the extender in to get through the rest of the pregnancy so there's enough room. Addie, I see you're here. Good. Let's see. Yeah, that's true. People do buy the wrong size bras. I have to stop myself all the time because I'll be in the stores and I'm like, I see people wearing the wrong bras all the time, and you can tell because the straps are falling down too loose, the back is riding up, the front is like, you know, digging into the breast tissue. You know what I'm talking about, right? Like some of you are like, yeah, me, right? That's what happens when the bra's not fitting right. So we're going to do more education on bra fitting because we all need them and we all don't know what to do with it. And when it's for nursing and pregnancy, I mean, this is your equipment. Like, you really need it to work. So we're going to do some more work on that. What? Would you guys like if I did some more education on bra fitting? Would you guys like it if I give, yeah. Yeah, I think this would be a really good show to do, where we really go into how to fit the bra properly and give you some good tips and advice for that. So, yay. Okay, so hearts for Addie. Good question. We're going to do more for that, but I just wanted to make sure I got to that for you. And the main part of that was, when do you buy them? Earlier in the pregnancy. Don't wait, okay? Earlier. Excellent. Look at all those hearts. Love it. Love it. Okay. Sip of coffee. Lucky's barking over there. What's the matter? He sees something in the corner. He thinks it's his, and then he starts to bark at it.
It is.
What is it? Somebody put his toy where he can't reach it. Yeah, so he's very upset over there. Okay, let's move on to the next question here. I think we're gonna go to, oh, there's his toy. Okay, let's go on to Sierra. Okay, Sierra asked the question, I'm considering having a physician perform a tongue tie release on my baby. Could you share your experience and outcomes working with moms and babies attempting to breastfeed post tongue tie release? Well, actually, this was very good timing because just this week, actually it was last week, and she came for a follow-up this week. Last week I had a client who came over for a lactation consultation. She was, her baby was 6 days old, struggling with very sore, cracked nipples ever since the hospital. I mean, she was struggling with it. A lot of pain. They had given her a nipple shield, and so she was really, really struggling with the latch. And of course, I helped her work on the latch and do better with that, but those nipples were just so sore. And when I looked inside the baby's mouth, I could see that little piece of, and what it looks like, a tight frenulum looks like a, it's that tissue that connects the floor of the mouth to the underside of the tongue. And you could see that it was there, and it was prominent, and it was holding and restricting the tongue. The baby was able to stick their tongue out, but couldn't lift their tongue all the way up. And so my advice to her was to get that fixed right away. It could have been the reason, it may not have been the reason, but it was better to do it and just get it done than to take a chance that it was it, and then she loses her milk supply, or she continues on with a difficult, painful latch. So she did go to see a specialist, and turns out the baby had not only a regular tongue tie, but a regular tongue tie, a posterior tongue tie, a lip tie. They revised all three, and she texted me that immediately following the procedure, like immediately, she nursed the baby without pain. And so, Sierra, to answer your question, if you're asking me this, it's because somebody's probably already diagnosed your baby or told you that there is some type of a tongue tie, And I would recommend, yes, go ahead and have it done. If you're struggling, and even if you're not, long term, tongue ties can cause difficulties with speech. So you want to go ahead and do this anyway. If the baby does have a tongue tie and you're breastfeeding, it could become a problem. So when you ask me here, babies attempting to breastfeed post tongue tie release, usually it's much easier. Usually it is much easier. So yeah. And so everybody's kind of chiming in here, and that's great. Lip ties worth getting fixed if not impacting breastfeed. Yeah. If not, she's asking a question. Michelle's asking a question. Is a lip tie worth getting fixed if not impacting breastfeeding? It depends on the extent of the lip tie. So if you're talking about, and I have another client right now too, who had no issues breastfeeding, no milk supply problems, no pain, but the baby is like maybe 9 months old, 10 months old now, with a pretty severe lip tie. She didn't even know it because she had no pain, but they're going to go ahead and fix it anyway. One of the things, like I was saying, it can create difficulties with speech and mouth motor development. So it depends on the extent. I would have it evaluated, Michelle. See what happens from that. But it doesn't necessarily mean that you're going to have problems breastfeeding. Yes, Sierra, having poor transfer issues right now, then absolutely. And don't wait, run, don't walk, because that can happen quickly if you're having poor transfer issues right now. Which she means is she's having poor transfer of milk to the baby. I'm assuming that could quickly dry up your milk and make your milk supply low. You don't want to do that. So make sure that you're pumping a little bit after the feedings. Make sure that you're expressing as much milk as you can right now until you get this corrected. And it is such a simple procedure, and you can breastfeed immediately after. Good question. Thank you for asking, Sierra. Let's give Sierra hearts. Lots and lots of love and good wishes for her to have this repaired and do way better and preserve her milk, because it's very important. So lots of love to Sierra. Let's see the hearts. Let's see the hearts. Oh, there they are. Okay. Fantastic. Yay. I love you guys. You're so wonderful. You're all so wonderful. Okay. Let's move on. Another question. Sip of coffee. Sip of coffee. We're going to sip of coffee. Okay. See, I'm getting more awake as we go, Joe. Getting more awake. Thank you. That's delicious coffee, by the way.
Organic cinnamon hazelnut.
What is it?
Organic cinnamon hazelnut.
Organic cinnamon hazelnut. Oh, organic cinnamon hazelnut. What a perfect lead in to our next question here. There you go. Perfect. Yes, I drink organic coffee. And Carly's question is organic versus non-organic. I swear to God, that's what I had here. I swear to God. Okay, organic versus non-organic. Which baby products are worth spending more money on to get organic, and which ones don't make a difference if they're not organic, if they're organic or not? Mainly concerned about diapers, wipes, crib mattresses, bottles, and pacifiers. Excellent, excellent question. I love this question because it's so important. Okay, so I say this all the time. Not everything that you buy for your baby needs to be organic, okay? Not everything needs to be organic. The things that you want to focus on are the things that you cannot wash, the things that they're putting in their mouth, the things that you are feeding with, like bottles. I would prefer to see glass bottles over plastic whenever you can. So that's not a matter of organic, not organic, but it's about plastics. And the things that off gas, and that happens to be mattresses. So you're mentioning that here. And yeah, those are the things. So the things that you want to consider are your baby's crib mattresses, for sure. Okay. And that's where Lullaby Earth, who is our sponsor tonight, makes amazing crib mattresses. They do both the Naturepedic line, which is organic mattresses, and they also do Lullaby Earth, which is a toxin-free, PVC-free, flame retardant-free. They don't off-gas, and they're just safe for your baby, chemical-free mattresses that are also waterproof. So that's really important too, is to have that waterproof feature as well, because if the baby pees on it or throws up, you know, you don't want any of that getting into the mattress that then can breed bacteria and other things, okay? So mattresses, definite, like on the top of the list of organic versus non-organic. Second thing is nipple creams, okay? Things like that where you're putting in baby's mouth. You're going to put it on your nipple and then your baby is sucking and that's going to be going into your baby's mouth. So organic nipple creams, the one that I love, you all know, is the Earth Mama Angel Baby Nipple Butter, okay? Completely organic, GMO free. It's completely non-toxic to your baby, completely edible. It's great for your own lips too, for chapped lips. But nipple creams, second on the list, okay? And, you know, the other thing too that is really, she's asking about diapers. That's a whole other conversation in itself. But the diapers, you know, disposable diapers have lots and lots of chemicals in it. So diapers are one of those things that you cannot wash unless you're using cloth. So if you're using cloth diapers, you're not going to have that chemical exposure to the baby. But disposable diapers, you are going to have a chemical exposure. And a lot of people go, chemicals? There's chemicals in the diapers? And yeah, there's a lot of chemicals in the diapers. So not only that, there's, you know, so there's chemicals, there's dioxins and bleaches and the sodium polyacrylate, which is the sap, the gel beads, okay, that are inside the diaper are pretty toxic. So getting the most natural diaper that you can, and cloth is like the best that you can do. And even if you're not going to do cloth 24 hours a day, but even if you did it part-time, if you just did it when you're home, if you just did it while the baby was sleeping, you're decreasing their exposure by 50% over multiple years. So I encourage cloth diapering, even if it's not full-time, but anybody who does it winds up doing it full-time because it's really so easy and you wind up liking it so much better. So if you have questions about cloth diapering, you know that I have a cloth diapering class. It's actually a really good class. It's for people who know nothing about cloth diapers. So if you want to learn about cloth diapering, you go right to my website. Joe can post a link. You want to post a link? It's a great class. If you're, you know, if you want to take a class from me, fantastic class. We filmed it in Colorado. We did it with a ton of babies, and I show how to, you know, go through from soup to nuts about cloth diapering and how to care for them and everything. Anybody out there watch the cloth diapering class? Has anybody watched it who can say whether it was good, if you liked it or not? That cloth diapering class is a really good one. And you know, the other thing too is if you take one of my classes, for those of you guys who've taken any of my classes, did you guys realize that the my private group launched last week, and it's open to anyone who's taken a class with me. So yeah, Chelsea watched it. Oh, right. You did watch it. You loved it. Fantastic. Yeah, it's a great class. And if you watch any of my classes, you're able to join our private group. And if you've already watched a class, make sure that you join the group. We can also put up a link to the application page for the private group.
You have a link.
There's a link. There's a post from like last week.
No, but your classes page.
Oh, right. Okay, that's right. Oh, right. Right on the classes page, there's a link. Awesome. And if you watched a class, make sure you go join. We got some great conversation going on over there. Yeah. So those are some of my top recommendations for organic. What I don't think needs to be organic are things like clothing. Okay. That's good for the environment for sure, but you're going to pay a lot more money for it. It's once you wash the clothing a few times, it's totally fine for the baby to use it. So you don't really need to spend your money on organic clothing. The wipes are important, the mattresses, the nipple creams, those are all important things. Okay, so make sure that's all organic. And again, the bottles too, glass bottles are great. Evenflo Feeding makes some really great glass bottles, really inexpensive, but fantastic glass, and they're really cute too, and they have good nipples on them too that I really like for breastfeeding babies. Okay, whew, there we go. What brand of wipes? You want to just get ones that are chemical free. Okay, Grovia makes some good wipes. We saw some at our ABC show with Water Pura, right? She made some great wipes. Anything that really you just want the most natural, chemical free as you can. You can just use cloth wipes too. Cloth wipes are the best, to put a little bit of like a wipe solution. You can even make wipe solution. I'm sure some of you guys have some good recipes for that. You can put a little bit of the Earth Mama soap and just water and wipes. That's really all you need. Water wipes. Water wipes. Water's really the best thing you can use on your baby. All the chemicals in the wipes. Think about it. When you're in the hospital and they tell you like, don't use the wipes on the baby. They give you like the dry wipes to just put water on and then wipe your baby. That's because there's chemicals on those wipes and they know it. But then why is it okay when you leave the hospital to go ahead and use it? Yeah, you need to use water. Okay. Let's get hearts for that. That was a great question, Carly. Thank you so much. We don't talk about organic versus non-organic that often, but it's an important topic. Let's give hearts for Carly and her question. Thank you, Carly. There we go. Yay, yay. Okay. Oh, all right. Let's see. I'm reading you guys here. Okay. Yeah, you guys can answer some of these questions too. All right. Okay, wait, hold on a second. So Macy has a question. My 4-month-old got put on antibiotics today for 7 days. If I take a probiotic, will he get any of that through my breast milk? If not, how do you suggest to get probiotics while exclusively breastfeeding? If not, okay, but exclusively breastfed, heard most are in powder form. Well, yes, that's true. And what you can do is you can pump a little bit of breast milk, mix it with some breast milk and feed it to the baby in a bottle with some express milk. But I think it's a really important thing to do, especially if the baby's on antibiotics. Why is the baby on antibiotics? That's my question. Unusual. So the fact is that, yeah, you can still use the powder. Just mix it with a little bit of expressed milk in a bottle. Okay. All right, so let's move on to one of the questions that was online here. Let's see. Okay, Lore asked the question, thinking about starting solids, can I discuss how to transition and how do I recommend starting? Okay, great question. So first, let's talk about the timing with solids, all right? This is important because a lot of people have a lot of misconceptions about this, and I was surprised to hear some moms talking to me about it, thinking that, they can start feeding solids as soon as their baby has teeth, or they can start feeding solids as soon as their baby looks interested in food. This is all not true, okay? Although some of those things like interest in food is one of the signs, you still want to give it a certain amount of time. All right, so I don't recommend feeding solids for an exclusively breastfed baby. I don't recommend feeding solid food until after 6 months of age, okay? Really, you need to wait until 6 months. There's a reason for that timing. The reason that you wait until 6 months is because the baby's gut closure, the maturity of their intestines does not happen until 6 months. That means that their intestines are porous up until that point. And so whatever food your baby is consuming will leak into their bloodstream through the porousness of their gut or their intestines. And that just doesn't close until 6 months. So it's important, and this is why, and that could set them up for food allergies and other problems, or autoimmune issues. So I just really recommend waiting until 6 months with your breastfed baby. When they get teeth has nothing to do with it. And this is actually one of the breastfeeding myths I'm about to write for my Facebook page. Because I just had 2 people say the same exact thing to me. Well, I started the baby on solids because the baby has teeth. And I'm like, My child had teeth at 4 months old. That didn't mean that she was ready to eat. Now, 6 months is the minimum. Do you have to start at 6 months? You don't. You can wait. As long as the baby's getting enough from the breast milk, you can wait. But wait until the baby is ready for solids. That means that it's at least 6 months. The baby's showing interest in solid foods. The baby is able to sit up on their own. You're noticing that their tongue thrust has decreased, where they can actually consume food instead of thrusting their tongue out the way they do when they're breastfeeding. All those things are going to be relevant to starting solids with your baby. And you know, if you're going to just let your baby do it on their own, like baby-led solids, that's going to be just letting the baby hold the food, taste the textures, eat the food themselves, and let them go at their own pace. And that's actually one of the best ways to introduce solids to your baby. Here's the other thing. You asked me, how to start. The other part of this is not just when, but what. And so much misconception, again, around whether the baby needs to have cereal. The baby does not need to eat cereal. And in fact, I don't recommend rice cereal for the baby at all, even though so many times the pediatricians, it's very old advice, to start with rice cereals. And that's just absolutely not true. You want to start with good fruits, vegetables. Vegetables be the best thing to start with. Avocados, all these kind of good, healthy, nutritious foods to start your baby with is absolutely much better than starting with any kind of grain or cereal. So for a lot of you guys, that might be surprising, but that's the truth, okay? When you hear people saying you can start solids anywhere from 4 to 6 months, that's actually if the baby's being formula fed, or even if you're combination feeding where you're doing some breast milk and some formula or all formula, then yeah, anytime from 4 to 6 months, if the baby looks ready or has those signs of readiness, then yeah, you can go ahead and start introducing solid foods earlier at around 4 months, because remember, the baby's already taking in something other than breast milk. So you can go ahead and, instead of more formula, you can give some vegetables, okay? They're already taking in something else. So you can start a little bit sooner. But for breastfed baby, 6 months and older. Good question. Good question. Thank you, Laura. Hearts for Laura. Hearts for Laura. Okay. Okay. Your pediatrician told you 4 months and then yelled at you when you didn't start her. Yeah, that's just really old advice. Again, Nicole, just like I said, this is where you guys need you guys have to have the knowledge. What? Joe said time for a new pediatrician. Yes, maybe. But the point is that you have to have that knowledge so that when you're getting advice for your child on anything, not just on your baby, but maybe on your pregnancy, whether it's your obstetrician, your midwife, whoever, okay, you need to be doing some of this research yourself, doing some reading, deciding on learning some things, because what you may be getting may not be the most up-to-date information, may not be accurate information, as we all know. And the greatest advantage that you all have as new moms right now, and I'm going to say this because it really is an advantage that for so long women and moms and dads did not have, is that you have the internet right now. Now, this could be a disadvantage if you start looking everything up and you're getting advice from the wrong people. But when you can find trusted advisors, like showing up here tonight, doing this with me, taking classes with me, or finding other experts that, you really trust and respect, or other moms and communities where they're doing what you're doing and you can ask questions, and you've got access to so much right now to really educate yourself. There really is no excuse for not knowing other than, just not looking into it. So that's why you're glad you have me. I'm glad I have you too. This is fantastic for me because I get to share my experience and my advice with all of you. You guys get to learn, and I know every single time we answer some of the same questions, but look, there's new moms coming in all the time asking the same questions. For example, we had a question from Krista, okay? And Krista said, I am 31 weeks pregnant, and I'm on the market for a breast pump. I'm completely overwhelmed by all the options, and I was wondering if you had any recommendations or tips on what to look for when buying. You think I have some recommendations and tips about breast pumps? What would I say to Krista here as far as what to look for in a breast pump? Now, I know all of you guys are going to be able to do this for me, so I can just sit back and watch the answers come through. What would I recommend? What brand would I recommend? And also, what would I look for? Yeah. I'm laughing because, see, I was just saying that every day there are new moms coming on that have never watched these before, have never joined us before, and they're joining for the first time. Closed system, Evenflo, closed system. You got it. Variety of flanges. They know. See, I know you know. So, two-phase expression. No, actually, what I recommend is multiple settings, okay? Not two-phase expression. There's the pump, okay? Adjustable speed and suction. So you have many options, not just two-phase expression. Multi-suction. Exactly, Cami. Exactly. So those are the three features we look for. Multiple, excuse me, multiple flange sizes included with the pump. Okay, that it comes with it. That's what you meant. I knew what you meant. Sorry, Kate. Multiple flange sizes included with the pump. Adjustable speed and suction controls where you can adjust both separately, and a closed system pump where there is no milk or anything splashing into the tubing. Okay, so those are the three features you're always going to look for in any pump. And then, Krista, the Evenflo Feeding pump, that's the pump right there. It's a little bit of a mess, is the pump that I recommend. It's also the pump that I helped to design. It's why it has all those features and more, some other really good features. It is definitely the one that I love because I've done all the testing on it with my other lactation consultants on all the moms for this. So we know that it works really good. I have huge experience with it. And it comes with my classes for free. So what else could I recommend except that pump? Yeah, it's my favorite. And it's really affordable for such a good pump. It's like a fraction of some of the other pumps on the market that it outperforms. Definitely outperforms. So good question. And it's a great example of, yeah, it's one of the most affordable, best pumps ever. Agreed. It's telling me my connection is weak. So tell me if you lose me or you can't see me, okay? Yeah. All right. So yeah, that's a perfect example of, there you go. Oh, good, Krista, you're here. You're welcome. Yeah, there's a lot of people here on the chat who are using that pump, and they know, and they'll tell you. It's not necessarily the one that you're going to hear your lactation consultant or the nurses or people talking about at the hospital, unfortunately. But trust me, it's a really good pump. Okay. What else here? Coffee time. Coffee break. Hold on.
What's the name of the pump? Do you want to give her
What
her
does she have?
website or the
She wants
website?
to know more about the pump.
She said, can you name it?
Oh, the name of the pump? This is the Evenflo Feeding Advanced Double Electric. Okay? The Evenflo Feeding Advanced Double Electric. Evenflo Feeding. You can you can look at the videos on my Facebook page. You can look on my website. You can go to Evenflo Feeding to get more information, but I've done a ton of videos on this. And then Jamie Grayson, we do a Q&A every single month for Evenflo Feeding on his Facebook page, and I have them all up on mine, and he has them on his in the library, and they're great. And we talk a lot about the pump, all the different features, and a lot of pumping questions too. So if you're curious, there's so much information. My consultation, she was here this week, and she was like, of course, asking me a million questions as she was walking out the door. And she's like, oh, I just feel like I'm going to need to know so much more from you. And I was like, okay, let me show you something. And so I went onto my website and I clicked on video library index. Okay. And 700 videos or 600 videos popped up on every single topic. And we sat there giggling, just going through. I'm like, you're going to be so sick of me. You want to watch more? You want to learn more? It's all right here, right on my website, on My Baby Experts. You go to mybabyexperts.com, right there, video library index, and you've got hundreds of videos to watch, okay? So pretty much everything I could say has been recorded at some point. Although we do surprise ourselves sometimes and come up with something new. All right. Let's answer a pregnancy question. Where was that one that somebody was asking me? She wanted to know. Oh, this came from Kara. I thought I saw Kara's name. Kara Graham. Okay, Kara said, do I have any books or suggestions? Can I suggest any books on natural birth VBAC? We want to go all natural, but we do not want a doula. Okay. First of all, what I'm going to recommend to you is that you go over to the is it ican.org, Joe? It's the VBAC cesarean awareness website, and they're fantastic. .net. I can't. Joe's going to give us the link here, but if you're planning a VBAC, you definitely want to go to their website.
ican-online.org. I'll post it.
ican-online.org. Joe's going to post it right now, Kara, because that's a really great resource for anybody who's looking to VBAC. They're going to have some great information, great books, resources, websites. That's what I would recommend looking at. And as far as the doula, go on my video library index and do a little bit of searching around. I did a whole interview with the people from ICANN. We've done doula interviews. We've talked so much about it, and really think about whether, depending on who's going to be your provider, if you have a really great midwife who's going to be with you, just remember they're not going to take the place of a doula. So you may want to consider that. Okay, Joe just pinned it. Fantastic. Okay, good. Yeah, but that's going to be my best recommendation for resources. The books change over time, and the one that the place that doesn't change are these organizations that do so great with that. So, hearts for Kara, and lots of good wishes and luck for her VBAC birth. We love that, and I did so many VBACs in my practice. That was one of the specialties of my practice. People would come to me from all over the place to VBAC. I did all hospital deliveries when I was a midwife, but a lot of people came to have their VBACs with me, and it was always such a amazing experience to watch someone be able to accomplish something that they've been told, or that they couldn't do, or that they wanted to do and were able to do it successfully. So I love that. Your next baby will hopefully be a VBAC. Yeah, awesome. Okay, let's do a few more questions here. Going back to my first page. Okay. Okay, Stacy. Oh, coffee break. Hold on. I've had this cold too for a week and a cough that once I get started, it gets spastic where I can't stop coughing. So I have to catch it early. Okay. This question came from Stacy, and Stacy said, I just bought my double electric Evenflo pump. Okay, so great. So Stacy bought the pump we were just talking about. She has her doctor's okay to start nipple stimulation. How do I go about it? What level, what speed, and for how long? Thanks for your help. Okay, so for those of you guys who don't know what she's talking about, stimulation of the nipple can initiate and start labor or contractions. If you are ready to give birth, if your body is not ready to deliver, you can do all the nipple stimulation in the world. You will contract, you will wear yourself out, you will be exhausted, but you will not go into labor. If your body is ready to labor and you're starting to efface, and your cervix is starting to get effaced or thinned out, it's starting to dilate, and you are ready to go into labor, nipple stimulation can stimulate that. Now, how that happens is the same way that when you're breastfeeding, the baby sucks at the nipple. That stimulation to the nipple triggers a hormonal release or response in the brain that releases oxytocin. Oxytocin is that hormone that also contracts the uterus. So nipple stimulation late in pregnancy can release oxytocin and then cause your uterus to contract. Again, I love that she said here, she has her doctor's okay. Because you never want to do this without checking with your doctor or your midwife first, okay? For multiple reasons. First, you have somebody who's taking care of you. You need to be on the same page together when you do anything like this. And also, like I was mentioning before, a lot of nipple stimulation without an effaced or dilated cervix is just going to cause you to have what I call, or what we call, irritable uterus, where it's just contracting. There's no real pattern to it. It's going to make you very uncomfortable, and it's not actually going to put you in labor. So then you might not be able to sleep, which is the worst thing, is that you're not getting enough sleep so that when the time does come, you're exhausted. So you really want to make sure you're doing this at the right time in the right way. She wants to use her pump for nipple stimulation. Krista, Stacy, you can use your pump, but you can also use your hand. Taking your hand and rubbing your nipples will actually create the stimulation that you need to cause that oxytocin release. So you can do it with your hand. You don't need to use the pump. If you want to use the pump, then my recommendation is to do it very gently. You would put it on like the lowest suction, maybe a quicker speed, more of that letdown mode, where you start off with that higher speed, lower suction, and do it that way just to stimulate the nipple. Again, it's the same thing as when you're trying to get a letdown with your breast milk. That higher speed, lower suction initially is going to be that thing that causes your brain to release oxytocin. In this case, when you're breastfeeding, what the oxytocin is going to do is contract the little muscles around the milk ducts to express the milk so that the milk ducts contract and milk comes out. But during pregnancy, it will contract your uterus. Okay. Nicole's saying, the worst, I had that constantly for 2 weeks. Yeah. Irritable uterus, okay? The worst. It makes you very irritable. Okay, it's exhausting. So I don't want you to do too much. The other way to do this is, in addition to doing it at the right time, doing it gently, is when you do the nipple stimulation, if you feel the contraction starting, you stop. Okay, so you stimulate. You start to feel a contraction, which can feel like just a tightening. It could feel like back pain. It could feel like a little bit of pelvic pressure, or it can feel like a cramp. You stop the nipple stimulation. You breathe through the contraction. You relax as much as you can through the contraction. And then once it's over, you can stimulate again to see if you can get yourself into a labor pattern. Again, I'm going to say, do not do this without the direct supervision or advice from your doctor or your midwife. I am not your midwife. I'm not going to be delivering your baby, so I'm just telling you how to do it. But you do need to be working with the person who will, okay? So make sure that you get their approval for this first, okay? Yeah, but that can really work. I've done that a lot with clients. They're dilated, their cervix is super thin. They just need to start having some contractions, and nipple stimulation can work great for that. Okay, there's lots of things you can do to stimulate, and help with your labor. One of the things that I used to do all the time with all of my patients was something called evening primrose oil. I don't think this is something we've really talked about much, but evening primrose oil is a great supplement to take because it helps to release prostaglandin at the cervix, which then helps to soften and thin out the cervix. So talk to your midwife or your doctor about evening primrose oil. I used to start my patients at, I think, around 36, 37 weeks, taking it orally every single day. And they would have, most of my clients did not go post dates or go too much past their due date, they would deliver, or they would get to their due date and their cervix would be completely thinned out. Yes, Kate, sex too, okay? So the prostaglandins in semen, okay, not the sperm, but the semen itself, okay, that has the same prostaglandin, and that will soften and ripen the cervix as well. So when people talk about having sex to induce labor, it's actually not the sex, it's the semen. So you need to make sure that gets up near the cervix and then lift your butt up on the pillow a little bit to let it sit there. Yes. Ha ha. Dads love that. My clients, the dads used to love that. I'd say, go home and have sex. Yeah. Kate, you're so funny. She keeps giving me all these things that I keep I'm sorry, I keep correcting you tonight, Kate. And you've got the right answers. You're right there with me. You are right there with me. I'm sorry I keep correcting you. You're so cute. So cute. Okay, let's have lots of hearts for semen tonight. Where did this go? Okay, this went south really fast. Okay. Don't get me started about, like I'm sweating now. Don't get me started on labor and birth. We could talk all night. Yeah. What? That's what it is. It's my midwife shirt. Okay, so for any of you guys that didn't see it, I have my midwife shirt on tonight. That's why we're talking about all this stuff, right? Because this doesn't always come up. But all the questions came, and I have my midwife shirt on. So it says, I'm a midwife. What's your superpower? So that must be the reason that we're talking about induction and semen tonight. Joe's just giggling and laughing over there.
Floating sperm emoji.
What?
You need a floating sperm.
Did you say that, or did they say?
I said.
Joe said we need a floating sperm emoji. Yeah, you can make that request to Facebook. Only on our live chats. Could I have the sperm coming across? Okay. Make Jamie bring his birth game. Yes, I definitely want to do the birth game with him next time. You know what? Actually, our next Q&A is coming up, and I'm going to Denver, so we will have it with us. He doesn't even have to travel with it. We're going to have to play the birth game. Should we do that? We'll ask him, okay? I'm going to Denver on, when is it? The 5th? December 5th. That's like 2 weeks. In 2 weeks from now. And the 6th is actually when our live Q&A is going to be. So we're going to be doing our Evenflo Feeding, breastfeeding and pumping Q&A on December 6th, which is in 2 weeks. It's less than 2 weeks. It's in 10 days. Oh my goodness. Okay.
Our husband said, what the hell are you watching?
Oh, your husband's asking you what the hell you're watching. Some crazy lady talking about, you know what. Okay. I won't say it again. I won't say it again. All right. So, do we have any more questions here that I can answer? I want to make sure that I get to some of these people who've been asking questions on my page. Okay, Amanda had a question about exercise and postpartum. Let's answer her question here. Amanda said, I'm a nursing mom of a 4-month-old, and I'm desperately trying to get back into my fitness routine, but I'm struggling. I was extremely active before and during my pregnancy, but now I'm struggling with being exhausted to the point that I have no motivation. I have used coffee as a stimulant for energy, but it's not very effective. Do you have any recommendations for pre-workout and or BCAAs that someone can use while nursing? Okay, here's my answer to you, Amanda. If you are exhausted, you need to listen to your body. You are breastfeeding. You just had a baby. Even though the baby's 4 months old, I understand that, but if you're exhausted, you need to listen to your body. You don't want to push yourself too much. You need to start off slowly. So maybe going for a walk. Maybe it's not your regular workout routine. Maybe you're going to have to work up to that at this point. That's all very normal. And I would rather see you doing more of a milder workout, whether it's walking or yoga, that type of thing, to start off after baby. Right now, you are already working hard. You're a mom. You're a mama now, okay? So you might not be sleeping well at night. That could be leading and adding to your exhaustion. You need to take care of yourself and your body. But easy workouts, okay, is what I want you to do at this point. You don't have to push yourself. Using coffee to stimulate yourself is not the answer either. The BCAAs, I don't recommend that during nursing at all for breastfeeding. I would say that the other thing you could make sure that you're checking is your thyroid too, because many moms will develop a hypothyroid postpartum when you've never had thyroid condition before. That can cause you to be extremely tired and exhausted. So just check that out. Have your blood work done. Look at your thyroid. Get your blood checked too, like to see if you're anemic, okay, because that can happen postpartum as well. But most likely it's from not sleeping a lot and just the change in your life. It's such a huge change to be having this baby now and breastfeeding, and you're working every day. You're creating milk, okay? So it's a workout, and it's actually burning a lot of calories. That's how much your body's working. It's like 500 calories a day going out in your breast milk. So make sure that you're taking care of yourself, okay? Yes, and your iron too. Very good, Kate. Very good, Kate. Yes, get your iron stored at your level. The iron will be is actually your blood work. When you check your H&H and you're checking for anemia, it's going to give you information about that. So yes, yep, I had that. I was exhausted. Okay, yeah, what was that, Elise? You had hypothyroid? Is that what you're talking about? I would say just take it easy. Give yourself time. Be patient with yourself. Everybody wants to jump right back in, try to get back to where they were. It might not be the case. You're just exhausted. And so you got to take it slow. And the last thing you want to do is wear yourself out, push yourself too hard. Not like anybody else I know, right? He's giggling over there. Because, yeah. Not like anybody else we know that pushes themselves too hard. Because we all do this to ourselves. And then where does it get us? Nowhere. It makes us sick. Okay. So yes, you're a pro. You're making me laugh tonight, Kate. I'm having fun with you. You're so cute. Yeah, it's not good for anybody to wear themselves out, and especially for a new mom. A 4-month-old baby that's nursing. Okay. Anybody else here? Let's see if we have any questions coming up. Okay, so Cindy needs recommendations on, hold on. See, this is why I can't do it this way because I can't see more. I'll wind up deleting the whole thing. Okay. I'm trying to stay on a healthy track as well. Need recommendations on protein shakes or protein powders that are okay to consume while exclusively breastfeeding. Having a hard time consuming the right amount of protein. I can't see the rest of your protein needed. Okay. Cindy, the main thing that you want to think about when you're taking, you can do protein shakes when you're breastfeeding. The main thing that you want to consider is that you don't want anything with artificial sweeteners, okay? I don't like artificial sweeteners anytime. But especially when you're pregnant or breastfeeding, you should be avoiding all artificial sweeteners. So I would get some kind of a all natural, an organic shake. Is there a brand that I recommend? Not really. The one that I drink, I'm trying to remember the name of it. Do you know the name of the Life? What's the name of the shake that we drink? That because we've checked it out before. There's no artificial sweeteners in it. I forgot the name of it. The brand. Joe's going to go check it out. Anything that is an all natural, no artificial sweeteners. That's going to be my best recommendation, and you can use that. They're going to have higher protein. It's going to be a whey protein, and that's going to give you the protein that you need, because you do need to have a lot of protein. Joe's going to check the brand for you, okay, because I like it.
Life Basics.
What is it?
The brand is Lifetime. The name is Life Basics.
Life Basics. Life Basics. Life's Basics?
Yeah.
Life Basics is the one that we use, and I know it has a lot of protein, no artificial sweeteners, no artificial anything in it. Yeah. So that's a good one. Okay, let's see. What?
The reach is almost 100.
Oh my goodness. Can we get some hearts for, this has been a really good Q&A tonight. We've touched on so many things, right? So many things that we normally don't talk about. Let's get some hearts for that. And let me just talk for a minute about the prize, okay? So tonight's prize is from Lullaby Earth, as I was talking about earlier before. And what they're going to be giving away is one of their Lullaby Earth Breeze Crib Mattress Pads, okay? So this is a cover for your mattress at home. So no matter what kind of mattress you're using, this is the Breeze cover that goes right over it. And what's so great about the Breeze cover is that it is breathable, okay? So they do, this is all breathable. And I don't know if you can see, if I hold it close enough, I think you can, that there's like little mesh here so that the mattress is breathable. And that means that the baby, for sweaty babies, okay, so that you can prevent overheating, it's really great for creating like an airflow underneath the baby. So that's the breathability. If the baby was to roll, the baby, you can really the baby can get more air circulated to them because of these little holes in the mattress. So it's fantastic. It's also completely waterproof. This is the other side of it. And we were talking about that earlier as well, that you want to have something that's waterproof, not just chemical free, but waterproof as well, because that way nothing's going to get through to contaminate your mattress. Okay. So this is completely toxin free. Okay. It's got no flame retardants. It's completely safe for your baby. It's completely breathable and completely waterproof. Yay! All good things.
No more
And it
sweaty
comes,
babies.
what?
Kimberly said no more sweaty
No more
babies.
sweaty babies. Babies are so sweaty, right? Even my older children need these in that size. Yeah, but it really helps them. And one of the things that is one of the ways to help to reduce the baby's risk of SIDS is to make sure that they're not overheating. So not only, Kate, we are so on the same. You and me, we are just like tonight, okay? Oh, it's so funny. Okay, yes, it's prevention. So you want to prevent the baby from overheating, and having a breathable mattress cover is going to definitely help that, okay? They also come in all different colors. You're not actually putting a sheet over this, and I get that question all the time, so I'll just answer it now. This is the sheet, okay? So you use this as your sheet over your own crib mattress, or you can get a Lullaby Earth crib mattress. This pad is this can go on any standard size crib, okay? So you can use it on anything you want. But this, you don't put a sheet over this, otherwise you wouldn't have the breathability of it. Joe just put up the link. Thank you, Joe. Okay, good. And it comes in different colors, so the winner's gonna get to choose. It's not like real dark, that's the inside of it, but you can kind of see it's like tinted green. I don't know if the camera's good. Tinted green, but they come in like pink, blue, green, white, and gray, I think. So you'll get your choice of colors too, okay? So if you want to win the Lullaby Earth crib mattress pad, all you have to do is hit like or love on the post itself, okay? So on the outside when we finish tonight, just hit like or love so that the post is tagged. And your comments here are going to get you an entry into win, okay? And we'll pick a winner in the next few days. That will give some time for anyone who needed to sleep through our broadcast tonight, because I know some of you got to catch your sleep when you can, and that's fine. I'm going to do the same thing tonight. As soon as we finish here, I am headed off to bed. So we always like to give some time for moms to go back, watch the replays. I know you guys do it, and enter for the prize as well, okay? So let's give lots of hearts for tonight. We are finished, and I'm going to say goodnight to everybody. I love you. Keep sending me your questions, and please, 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 if you are one of my students who have taken a class, make sure you're joining my private group, and if you want to be a student, just go to the classes page that Joe put up here on the stream, okay? You can get a class, you can watch a class, you can buy the pump and get the class. You can buy a manual, Evenflo Feeding pump, And it comes with my Simply Breastfeeding class right in it, and then you can be part of the group. So you can do that too. There's lots of different ways, but either way, whether you're part of the group or not, I'm so glad that we're here together and we can do these live streams, and love spending my Saturday night with all of you. Okay, so have a wonderful rest of your weekend, and I will definitely be seeing you all very, very soon. Okay, love you guys very much. Good night, everybody. Have a good night. Enjoy. Kiss your babies. Bye.